I forgot about that part.
Hello and welcome everyone who could make it today and those who are watching in the future. My name is Letitia with Team Culture, and we're happy to host another Program Spotlight. Program Spotlight gives us a chance to highlight the wonderful work and people who make BH Care what it is. Today, we are spotlighting the adult outpatient clinical services. For those who are unable to attend today or who would like to review the Program Spotlight, as Cooper stated, Program Spotlight is being recorded and will be posted on that program's respective service page on BH Connect by the end of the week. For example, today's Program Spotlight on adult outpatient clinical services will be under adult services. I'll now pass it over to Senior Program Managers, Anita Cipriano and Lauren Dahl. Thank you.
Okay, thank you. Hi, I'm Anita Cipriano, Senior Program Manager at the Valley Clinic. And my colleague that's doing this is Lauren. You want to introduce yourself?
Hi, I'm Lauren Dahl. I'm the Senior Program Manager at the Shoreline Clinic.
All right, so Lauren and I are going to go over some of the services we have at the clinic, and we'll be bouncing back and forth between our slides. So we want to talk about the clinical services at both sites today. Our clinic program provides mental health and substance use treatment. That includes individual and group therapy. It includes a few IOP, intensive outpatient programs. It also includes medication management as well as medication assisted treatment. We have two locations. The Shoreline location is at 14 Sycamore Way in Branford. Their hours are Mondays and Fridays, 8:30 to 5, and Tuesday, Wednesdays, and Thursdays, 8:30 to 8. The Valley Clinic's located at 435 East Main Street. We have a little different hours. We start Mondays and Fridays, 8 to 5. And Tuesday, Wednesdays, and Thursdays, we work 8 to 8 with clinicians working various hours. Our eligibility requirements are clients from 18 years or and older that have a mental health or substance use disorder that need support, need some other ancillary services that we'll refer them out to, and we take everyone's insurance. Next slide. Our clinicians are made up, have our licensed clinicians, licensed clinical social workers, LMSWs. We have psychologists, LPC clinicians, LPCA. We have some clinicians who have an art therapy background. We also have some clinicians who are trained in EMDR and several other clinicians that have been trained in ART therapy. Next slide, please. And here's our team. Next slide. So at the Valley, we'll show you all the pictures of and everybody's names and what their titles are. And we listed how many years they've been here in the clinic. So for the Valley Clinic, we have 20 clinicians and 1 clinical case manager. And the variety of years from here for 23 years up to a couple of months. We have a couple new hires that are newly licensed clinicians. Next slide. I think that's going to hand it over to you, Lauren.
Thank you. Okay. So I'm going to present the same information, but for the Shoreline Clinic. So here on this first slide, we have our Shoreline Clinic leadership. So we have the Director of Behavioral Health Services, Senior Program Manager, 2 Assistant Program Managers, and our YAS Program Manager on there. And as you can see, like Anita said, we included their names, how long they've been here, and their titles. And then if you just want to go to the next, yep. So here's all of our clinicians. I think that we have 11 currently here on the Shoreline. We do still have vacancies, but these are all of our clinicians here listed. And they all do different programs. So some are mainly in IOPs, while others are in outpatient groups and individuals. You could keep going. All right. I'm going to present our psychiatric providers. So both clinics have psychiatrists and APRNs that provide medication management for our clients, as well medicated MAT to treat clients with opioid use disorders. And that is Suboxone that we provide. So here, similarly to the clinicians, we have our psychiatric providers listed with their names. Some of them don't have pictures, unfortunately, but all their information is here. And our chief medical officer is Dr. Gomez. And then we also have clinical case managers. So the role of the clinical case managers is to really assist the clinic's clients with immediate case management stuff. So for example, someone may come in intake and really need immediate housing. They could get connected with one of them and kind of figure out a path to start that process. So really when clients need that true ongoing case management, a referral to formal case management will be completed.
Right, so I'm gonna talk about our same-day access for intakes in the clinic. Sorry, I'm choking and I have to close my window with the beeping. Sorry about that. So we have same-day access for intake, so clients can come walk in any time of the day, Monday through Friday, between 8:30 and 1. They'll have an intake and provide any referrals that's needed. The times are both the same at the Valley and the Shoreline. If a client is unable to meet that time restraints that we do have, we can make scheduled appointments with them. The same day access for intakes has been really successful at meeting the clients where they're at and when they're ready for therapy, and get the treatment that they want, versus when we used to schedule intake appointments and they'd be out for a week or so, and then sometimes we'd get a lot of no-shows. This way, we're getting people coming in, they're ready, they want their treatment that day, and gets them started when they're ready for services. Next slide. The next slide talks about our crisis service. So we have crisis service that's 24 hours a day, 7 days a week. We have walk-in time. Clients could walk in any time between 8:30 and 5 o'clock and be seen by the crisis clinician. If they walk in after 5 and one of our staff that are working till 8 o'clock can meet with the client to help them if they need that. We have the crisis line that clients can also call 24 hours a day, 7 days a week, and speak to a licensed clinician. We also have mobile crisis. So our crisis clinicians go out between 8:30 and 5. And then we have South Central Crisis Service, who provides our mobile crisis after 5 o'clock and also our crisis line after 5 o'clock. So they have a number of crisis clinicians that'll be assigned to go out. The crisis line, the clients will call the number and they press 6 to get to the crisis service. They'll speak to someone who'll take their information, and then they will get a call back from the crisis clinician, and they'll decide whether or not they need mobile crisis sent to their home or not. We also just developed this year, a specific crisis line for the police departments, the local police departments that we work with. So they press 5 instead of 6, and that gets them right to the crisis line. And we've also, set up a crisis email for the police departments for referrals. So if they're meeting somebody in the community and need mental health or substance use treatment, that they can send us an email and it goes right to our intake people, and we'll be able to call the person and get them scheduled to come in, and we can follow up with them as well. Next slide. I'll hand it over back to Lauren.
So I'm gonna go over our outpatient groups. So both clinics have regular outpatient groups that meet once a week for an hour. And these groups are focused on a lot of different topics, mainly the topics that you see listed here. And for those of you who aren't familiar with CBT, DBT, and MI, it's cognitive behavioral therapy, dialectical behavioral therapy, and motivational interviewing. So most of the groups have those types of therapies in them for the most part. You could go to the next. And then we also have intensive outpatient programs. So these ones meet 3 times a week for 3 hours a day. So they're definitely more intensive. The Valley currently has 2 IOPs running, current or soon to be 3. They currently have dual diagnosis IOP and symptom management IOP, and then DBT will be coming soon. And then Shoreline, we currently have 4 IOPs. We have substance use, dual diagnosis, symptom management, and DBT.
Okay, so one of our other services, we have ACT team services. So that's comprised of, it's a modified ACT team, has a clinician and a case manager where they provide most of the clinical services and case management services out in the community or the client's home. Usually the clients that are in the ACT program are ones that have some more significant mental health issues or substance abuse issues, have issues with not connecting, not engaging. So they're making a lot of progress with meeting clients in their home and the community. A lot of these clients could be very hard to engage or have some higher risk issues. They may have multiple inpatient stays or multiple ED visits. Some of the clients that are in the ACT team also have struggled with med adherence and keeping up with their ADLs, their activities of daily living. So having that clinician and the case manager working as a team going out to meet the clients has been really pretty successful. So that's our ACT team.
And then
Send it back over to Lauren. Go ahead.
Thanks,
Sorry.
Anita. That's okay. So then I'm going to talk about our jail diversion services. So our jail diversion program works with both the Derby and New Haven courts. And they represent our clients that have mental illness or substance use disorders. And the person is assessed and determined if treatment would be more helpful for them than criminal charges. So on the next slide, Kathy Prevost, our jail diversion coordinator, was kind enough to include a lot more detailed information for anyone that does want to reference it. I'm not going to read all of this, but she provided a lot of information that could be helpful for understanding this program. And then we're going to share a couple of success stories presented by 2 of our clinicians. Sadie, if you're here, if you want to go ahead first.
Yeah, absolutely.
Okay, thanks. I couldn't see you.
Great.
Yeah, it's hard with Teams to see when there's a bunch of people.
Right.
So yeah, I'm happy to share a success story. So one of my clients, I'll say his name is George. George, I've been working with actually since I started here at BH Care, so a year plus now. Before I started working with George, he many mobiles were done on him. Tara, the crisis clinician before myself, really talked about going to his house, having to send him to the hospital. His main diagnosis is schizoaffective, and he struggles with, or yeah, really struggled at the time, which prompted a lot of mobiles. Hallucinations, delusions, tactile hallucinations. He feels a lot of squeezing in his head, a lot of pressure on various parts of his body. He sees things floating. So visual hallucinations as well. And it actually prompted in a suicide attempt at one point due to it being so severe. He struggled to engage in services. He struggled to continually use medications and be med compliant. And he actually even started using substances, I think crack specifically, to get some relief. So now, kind of jump to now, for a while now, George has actually been engaging in services, attending appointments, never misses one, both meds and with me. Is med compliant, says there's been a dramatic reduction in symptoms, has a full-time job, is looking to strive to be in a management position, is going to Pilates once a week, has a very strong relationship with his significant other, and is doing really well, and recognizes how much his effort has gotten him to this place and how many strengths that he has. And yeah, that's, I would say, the success story. So George is doing great.
Great, thanks, Sadie. And one of our clinicians from the Valley, Emily Chanchamino, is going to give us our success story from one of our clients from the Valley.
So this client I've had as a client in both IOP, and I'm also her primary clinician. We both started at BH Care on the same day. We actually both sat in the lobby together waiting to be taken upstairs. So I've known her from the first moment I started here. When she started here a year and a half ago, she was in early recovery for alcohol use. And she began our symptom IOP program due to an increase in depressive symptoms. She had a long history of suicidal ideation and multiple attempts. She did very well in IOP, successfully graduated last summer. However, she was still finding it difficult to find the motivation to work, as well as continue to take on way more caretaking roles with other people in her life than she really had the capacity for. And this unfortunately led to a relapse in mental health symptoms. She maintained her sobriety. At the beginning of this year, in the spring, she had a serious suicide attempt, and her suicidal ideation was more intense than I had ever seen it in her before. So she re-engaged in our IOP program and medication management. She successfully graduated in this summer, and she is a totally different person now. She's working part-time. She's already been promoted at her job, and she's doing trainings on her own initiative so that she can continue to advance in her career. She's been able to say no to other people and is really doing well at setting boundaries, which she wasn't even open to that idea a year and a half ago. And without guilt too. I forgot I wrote that down. And I think personally what I see as her biggest success is she is in the process of changing her last name back to her maiden name to cut ties with a formerly negligent spouse that led to this person's death led to her alcohol use and depression. So she has changed her last name. So she's definitely a very different person. She's happier, she's more motivated, she's confident than she was when I met her a year and a half ago.
Great. Thank you, Sadie and Emily, for those great success stories. Next slide. So does anybody have any questions? Okay. Well, thank you guys for attending our spotlight in the clinic.
Thank you.
Great job.
Very informative.
Thank you so much, Anita and Lauren. If you have any questions, you can always follow up directly with Anita Cipriano for the Valley or Lauren Dahl for the Shoreline. Team Culture would like to thank everyone for coming to our Adult Outpatient Clinical Services Spotlight. We are planning on increasing these in the new year for maybe 2 a month, so please keep an eye out for emails from Team Culture. And again, thank you for everyone who attended today, and this will be posted on Adult Services page of BH Connect by the end of the week. Anyone interested in joining Team Culture, please reach out to Ebony, Emily, or Cooper. Have a great rest of your day.
You too. Thank you.
Great job.
Bye.
Great job.
Thank
Tony,
you.
did you want to ask your question?
Yeah, I was gonna ask lots of questions. And I was just wanting to say great job to everybody.
Thanks, Tony.
Okay.
Didn't want to feel like it. We forgot about you there. Wonderful.
No worries. Take care.
And in the original presentation, I wrote no question.
I was gonna start with, I have lots of questions for.
We'll take them. We can talk later.
Thanks.
Thank you, guys.
Thank you.
Bye.
Bye.